Broadcasting from the business capital of the world, this is the Podcast Business News Network. And we are back here with Dr. Nancy's Integrative Medicine. And it's Dr. Nancy's integrativemedicine.com. She is a physician. She believes in the Western, Eastern philosophy. She's an integrative practitioner. And again, it's Dr. Nancy Gaines Dillard. Welcome to the show today. How are you?
Hi, Jill. Thanks for having me. It's a wonderful day. I can't wait to get started.
Well, it's a beautiful day where you live. You're in beautiful Scottsdale, is it?
It is. Yeah, we're still in the 70s, 80s degrees. It's really nice. Although it's a little chilly in the morning. So, turtleneck on.
Yeah, 30s and 40s here in New York. I'm in the tank top. You're in the turtleneck. Something's wrong, but we're inside. So welcome to the show today. It's a pleasure to get to also see you face to face here on our live Zoom, just so our radio listeners are aware as well. Please introduce yourself to everyone and we'll get started.
Yes. I'm Dr. Nancy Gaines Dillard, family medicine board certified integrative healthcare practitioner. I've been practicing medicine for 25 years, specializing in family medicine, emergency medicine, acute care, pediatrics, you name it. I just wanted to do it all. I now have practices here in Scottsdale, Arizona. My alumni is University of Penn. And I was really drawn to the West Coast to bring more awareness to things and services that I offer. And I have my business called Dr. Nancy's Integrative Medicine. So I do a whole host of things. I practice like a primary care provider, but I do alternative allopathic types of treatments as well, IV vitamin drip, stem cells, monoclonal antibodies, telemedicine, aesthetics, weight loss, and I also do some motivational speaking engagements, as well as I have a talk show too, Dr. Nancy Knows. I have my own product line, a nonprofit. I often say, be a part of the solution and not the problem. What are you contributing to the world to make it a better place? And if you're not waking up excited about doing that, then something's wrong. Go back to the drawing board and start all over again.
Oh my goodness. Dr. Nancy Knows. And where can we find out more information about your show? Would you mind giving us where we could find it, the times that it's on?
Yeah, absolutely. So drnancyknows.com on the website. I am all over on Roku TV, Amazon Fire Stick. I am on all of podcast platforms, PBN, in fact, Deezer, Stitcher, Apple, Android, all of those areas. Just keyword Dr. Nancy Knows, and all of my shows will come up. What I do is I bring individuals that are experts in their field of industry to come on the show and talk about what their pitfalls were, who has mentored them, how impactful they are being in their communities as well. And it's giving hope, inspiration, and awareness. So honestly, everybody can do their part, and we all have the divine destiny or a journey and a purpose. And we need to just seek that out, because there are people waiting for you.
Beautiful. Well, for today's show, what in particular would you like to share? I know it is the first of our Zoom sessions, so I'm not sure if there's something you want to recap. How would you like to start off for today? What would you like our audience to know about you and your services? And there's clearly so much to you that the time is just not enough. We need a few hours. But how would you like everyone to benefit today?
Thank you for asking. An overview. Honestly, a lot of people want to know what integrative medicine means. And that means you, as a provider, is open to alternative treatment modalities. There are more than one way to treat a condition or a person. So if it's a person that's struggling with blood glucose control, there's a man-made product for that, but then there is also a whole plant-based product for that as well. And which would you want? Because plant-based natural products rarely give any side effects, right? Man-made medications can sometimes, depending on the sensitivity of, who we are as individuals and what other, medications that we might be taking. So I'm here to give individuals options for their health care to live their best life, right? So that's just one instance. But I do telemedicine. I'm licensed in multiple states. I have my own product line, NG Cares Customized Wellness, and it's based on micronutrient testing, genomic testing, your deficiencies specifically for you, to develop a supplement that is only for you based on your deficiency. deficiency. So buy no more at the store. And, there's a lot of individuals that suffer with mutations or struggling with living their best life outside of just routine blood work. Well, I get to the bottom of all of that, and I can practice that type of medicine in consultation nationwide.
Now we're talking with a series of different panels of, if you're doing blood work, for example, the amount of things you can find out about someone. Could you share? I mean, what type of testing do you do that seems to be most important for your clients?
That's an excellent question, Jill. Environment plays a major part in how a person ages and or predisposes them for disease. And so location, if you live on a golf course or you live near power lines or power plants, environmental toxins, heavy metals, food sensitivities. A lot of individuals suffer with leaky gut. These are the types of tests that I can do. I have contracts with a major pharmaceutical or laboratory that's nationwide. So you just have to type in your zip code where you are, and that's where you go to get your blood work. It takes about 2 weeks for those results to come back.
Okay.
And you have a consultation with me, and we sit down and figure out why you're feeling the way you are, or to get you to live your best life based on your blood work.
Got it. So we're talking, you could help us with different deficiencies in our bodies. You can help us with supplements, with eating better. I mean, you are a full service mobile.
Absolutely.
Now, could you talk about, is there any commonalities that you see amongst people, or what are we like deficient in? What are most people? I mean, and then you will also have to hit the whole COVID factor. You're known as the COVID doctor as well. So that's a whole nother factor. And you're also helping patients with that too.
Exactly. So, mostly B vitamins deficiencies, vitamin D as well, sunlight, right? Vitamin C. We are in the midst of cold and flu season. Of course, COVID is still around as well. And so we can't get enough of vitamin D, C, zinc. We really need to build up our immune system. Hence, I have a new product called Immuno Boost, and it comes in 2 formulations. One is an oral version. It's a complete antioxidant. And the other version of it is an injection. It has a glutathione, vitamin C, and zinc. So yes, we are mostly deficient in, just these simple supplements that can really make a difference and impact your life. And so yes, COVID, you really want to build your immune system up and not just make it normal or average, right? You want to make it above normal. So these vitamins that you need are more on the high normal side as well. So hence monoclonal antibody therapy. If an individual has COVID and they're within that 10-day window and they have symptoms and they'd like to, add an extra immune power to their healing process to limit the types of symptoms that you get and the worsening of COVID symptoms, monoclonal antibody therapy. It comes in 2 different ways, infusions or subcutaneously. I offer those here in my office here in Scottsdale, and they are available throughout the country too. You just have to follow up with your primary care provider, some urgent cares, hospital settings as well. It's available.
Got it. And so you have the right as a patient to ask for that treatment, correct? Or is it only given to those who have severe, you tell me how it works. You have a really severe case of COVID. Then again, how do you know from the testing what's severe, what's not?
That's an excellent question. You have to test positive for COVID, and then you have to have mild to moderate symptoms. And then you have to be within that 10-day window. So those are some of the screening tools that you would be asked prior to inquiring about monoclonal therapy to see if it's appropriate for you.
Got it. Good to know. Thank you so much. And, here in New York, we have not only the mask mandate back in effect for everywhere we go. By the way, I'm not sure if that's where you are in Arizona right now, but now you're not even allowed to go to a restaurant, and not just New York City, the 5 boroughs, the tri-state area, if you're the age of 5 and up to 11 without being vaccinated. That's a new law that went into effect as of yesterday. So that's detrimental. These people traveling here for the holidays, they didn't get their kids vaccinated yet. And then it's the pressure of those. Now, how do I do this? Now, there's so much. I mean, how is COVID going near you? And what are your thoughts on the new variant, if you don't mind sharing?
No, absolutely. I think we're going to continue to have variants because that's what viruses do. They mutate. It's like the flu. shot. Get that every year based on geographical exposures and how the variant is mutating. So I'm anticipating that there may be a booster shot that may be required every year. It is, it's freedom of speech, and here in Arizona is pretty liberal. We don't have mask mandates. It's up to you whether you really want to wear it. If you think that you're not vaccinated, they do advise that you do wear a mask here in the state of Arizona. But we're not checking cards. Some certain events like concerts and theater kind of gatherings, I believe they do ask for a negative COVID test or a vaccine card verification. But we cannot allow the virus to dictate our lives. Happiness is everything, and socialization is what, the foundation of what human nature and being.
I agree. I couldn't agree more.
And, the past 2 years, really just crushed the nation, but
social distancing, the new term. Yes.
Resilient. And there is a way to get around all of this as well. We will overcome. Absolutely. But, wherever you are and what state you're in, you just follow the rules and we'll all get through this at the end of the day.
Perfect. And let me ask you, by the way, could you get a blood test and you do the blood work to see if you have the antibody for COVID and how strong it is? Is there like a certain number that can come out that says, hey, you're okay, you have enough antibodies, or no? Could you talk about that for a sec?
That's an excellent question too. You either have antibodies or you don't. And typically if you have higher antibodies, that means the more recent that you might have had COVID. So, a little bit later after you've had COVID, you don't dissipate with the antibodies, but they become lesser. But some antibodies are better than none. And there's talk about natural immunity too, right? So natural immunity is often the best way.
To it, yeah.
Often the best way. And, there's a lot of controversy around if a person has actually gotten the COVID and has natural immunity, should they get the vaccine? That's another whole story.
That's a whole other topic and day. Yeah.
We're not going to talk about that today.
No.
But natural immunity is best. I just want to tell you that as well.
Good. Thank you. And what else do you have in store for us, Dr. Nancy? There's so much, again, to talk about. What would you like our listeners and viewers here to know about you and what else you're doing there in Arizona? And by the way, it's not just Arizona, because you also do telemedicine, right?
I do.
And your products ship. I mean, you tell me what you want to talk about.
Absolutely. Dr. Nancy's integrativemedicine.com. I have a whole host of products and services on the website. And if you don't know where to look, there's a search button there, and just type in anything that you want: monoclonal antibodies or stem cells or NG Cares product line. All of that is there on the website at drnancys integrativemedicine.com. I do want to talk about, we're here, the holidays are here, and there's all kinds of goodies around, whether you want it or not, and overeating tends to be an issue. And so healthy eating habits and, trying to maintain your best health through these holidays is often a struggle. Everybody struggles with that, right? And, it's different if you don't buy it at home, it's not there, and you don't have to worry about it. But in the workplace this time of year, everything is everywhere and it's very tempting.
Yeah. And just this morning, someone brought in a box of cookies. I'm like, there was apple pie last week, and it's like, you're bringing in the leftovers to us. And now I'm like tempted to eat it.
It's so hard to do that. Now, I have NG Lipoderm. It's a topical product that helps with natural topical product that helps with tightening the skin and clearing up stretch marks, as well as cellulite. NG Cares Lipoderm.
Okay.
And then, for fat burners, I offer fat burners, and they're all natural too. So the Lipoderm has an active ingredient called dioxychloric acid, and that's a natural chemical reaction in the intracellular matrix of our bodies that help emulsify fat. So it's a topical version to help you do that melt away fat on your skin. Topical. The fat burners that I use we call it MIC lipotropic, methionine inositol choline. Lipotropic meaning it breaks down fat, right? So it allows your body to process the fat instead of storing it. So these are some of the things that an individual can inquire about to help them, while not put on the weight and the fat, honestly. seek out a good, workout regimen. I have a couple of devices that help with weight loss and body contouring and muscle development. It's under ProFit Technologies. We have ProFit Laser Lipo and ProFit Elite. The laser lipo is a 7D laser, one of a kind, and it's non-invasive, no downtime, no surgery. 2 inches, you can lose up to 2 inches in 20 minutes in my office. And then ProFit Elite uses high fem EMS technology. What is that? That is high electromagnetic stimulation. So it does 20,000 muscle contractions to whatever muscle body part we put it on. So a lot of athletes use it, actors and actresses use it. Individuals that are suffering with an injury and can't do like weight-bearing activity, and they don't want their muscle to atrophy and shrink up. These are things that, can help with love handles and that six-pack that you've always wanted.
Does it feel like the tens machine or times a million?
Times a million now. It's a little intense. We say no downtime, no pain, but it's a little intense, and you have to work your way up to 100%. So we've gotten some really great results from these devices as well. And the reason why I bring it up on the show is it can be utilized as a business tool for all you business professionals, entrepreneurs out there that are looking for alternative ways to bring in streams of revenue and offer a service. So ProFit Technologies, if you're interested, Dr. Nancy's integrativemedicine.com.
Wow. How long now? Okay. So how long is a session for that? Like, let's say I have no abs. I'm naturally thin, but I have like fat on my stomach. I have 2 kids. I'm not super fat, but there's a lot, there's enough for me to grab it right now. So that's now when you tighten the muscle, right? First of all, how long are you going to be doing that for, right? And how many times do you need upkeep? And then what about the fat on top? So you got the muscle, and then for the fat, what type of like lipo stuff do you do?
Those are phenomenal questions. Yes. So I'm going to start with laser lipo, 7D laser. It uses 2 red light therapies and an infrared technology. So infrared penetrates through the deeper tissue around the subcutaneous or organ fat, I should say, the toxic fat, right? And then the 2 red lights are superficial, so that jiggly fat. So those 3 lasers together, 20-minute sessions a week, twice a week, will help tighten the skin and dissipate the fat cells of its contents, and it's permanent, so your body eliminates it. Then we back it up with ProFit Elite, and we put this device that does these muscle contractions, 30-minute sessions twice a week. So the laser is it's sold in a package of 8, so a total of 4 weeks for that. And then ProFit Elite is sold in a package of 6, so 3 weeks for that. Now, we have that same technology with ProFit Elite in a cushion, that high stimulation, electromagnetic stimulation in a cushion. And you sit on it with a pair of tights. It's non-invasive. And what it does for both men and women, it helps build the pelvic floor muscles. So for sexual dysfunction, for men, erectile, it helps with developing collateral circulation for a stronger erection. For women, it helps with all kinds of incontinence, stress, mixed, urge, as well as it mimics 10,000 Kegel exercises in one 30-minute session.
What?
Yes.
Look, I had 2 kids and I had to go to the specialist and I had to use that, don't know the name of it, but to tighten up because my bladder came out during pregnancy, amongst my cervix. It was so beautiful. And so to start tightening up, I had to go for treatment to the doctor, and it's still not the same. I was told I do need a surgery to lift everything, but and then yes, of course, the urinating and the urge just going, it happens. I'm 43. It's a little better now, but it still happens. And it's embarrassing. It's uncomfortable. And I didn't know that these other things existed for it. Wow.
They do. So that's what I'm here to do, is bring awareness, because there's millions of people that suffer with incontinence. And this device, the cushion, helps with fecal incontinence too. So, individuals that are suffering, they no longer have to. There are options that are not invasive. So you don't have to worry about going under surgery and having to deal with the effects of anesthesia and the risks that are involved with that as well.
Wow. Wow. This is awesome. See, I wish I lived closer for this stuff. Okay. But this is great. You also, besides, it is a holidays, we're talking about the temptation of overeating. And I'm assuming the busy season for people to start looking good comes New Year. Everyone makes those New Year's resolutions. What are the chances of them sticking? And I agree. Let's start earlier. And if not, you can give gift certificates as well, because that would be a great gift. Everybody wants to look better, feel better in every different aspect.
That's an excellent question as well. Yeah, gift cards and gift certificates are available. So remember, NG Care's customized wellness solutions is nationwide. And so individuals can call in to get gift certificates for their loved ones, for something that you're giving the gift of health. And so this blood work can really make a difference and be impactful in someone's life as well. And regarding New Year's resolutions, make realistic resolutions and set goals that are realistic. Nothing really overwhelming. It takes baby steps to get to where you're going. And it's simple accomplishments that you need to pat yourself and acknowledge yourself on the back, and then keep it moving forward as well. Yeah, so keep it simple.
Got it. Great. And as far as the other work you do, what else did you want to lighten our listeners with the last few minutes here today?
Yeah, awesome. I have a training academy, Dr. Nancy's Medical Training Academy, and my passion is CPR. And so not just only our healthcare professionals that are required to have CPR, but how about everyone? Your child care, au pair, your convenience store, your bank teller, your restaurant owner, your community luxury apartment groundskeeper and staff. CPR, it's a priceless skill set that will last a lifetime. Why wait for 911 when you have this skill that you can save someone's life? So CPR, Dr. Nancy's Medical Training Academy, it's drnancysmta.org to find out more information. And then I have a nonprofit, Family Matters Healthcare Foundation. And it's just giving back on so many different levels, rather it's after school programs, financial literacy, battered women, women getting back into the workforce, or young adults that are coming out of high school and not knowing what they want to go they can shadow at Dr. Nancy's Integrative Medicine to get an idea if it's medicine that they want to go into. So yeah, I want to be useful, and I want to be a humble servant and be all that I can be.
And give back. That is beautiful. Selfless, really. Can I just ask quickly for those new viewers and listeners out there today, what brought you into the field of medicine? Clearly you have a passion beyond to help. You could see it. I could hear it. I could feel it. Can I ask, when you were a little girl, is this always what you wanted to do, or what brought you down this path?
That's really great. Wow. Yeah. So I had some really great mentors in my life. And when I visit back with them, they're like, "Oh my God, I'm so proud of you." And I'm thinking,
Thanks
it's,
to you that you helped. Yeah.
oh my God, I say, well, thank you, but it's what I've seen in you and what you've instilled in me that's made me become who I am.
Oh,
And it's amazing, truly amazing.
oh, it's
So
beautiful.
as a little girl, I just knew that I could be anything that I wanted to be. And that's what I am continuing to do, is be
Great.
all that I can be.
A lot more, my goodness, because the fact you're giving back and do so much is just really, it's amazing. Let's go over again the best forms of contact for you. I can tell them the website, Dr. Nancy's integrativemedicine.com, but then there's so many other forms of contact and different websites. Would you mind sharing again for NG Cares?
Yeah, ngcares.com. I will give you a whole host of information about, my customized wellness solution testing as well. So NG Cares, Nancy Gaines Cares, ngcares.com. I'm on Facebook, Instagram, LinkedIn. Facebook, Dr. Nancy Knows. Facebook, Dr. Nancy's Integrative Medicine. Instagram, Ask Dr. Nancy, AskDrNancy. Instagram, Dr. Nancy Knows as well. LinkedIn, my name, Nancy Gaines Dillard. So I am here to be of service and to help in any way I can.
And the number 480-669-6452.
Yes.
480-669-6452. And just one last question for you about, what do you love most after you're, working with a patient? What is it about what you do that makes you continue to do more and more each and every day?
The impact that I have on them that they tell me. They skip into the office and they're like, "Oh my God, I'm already happy. You make me so happy."
Feeling better, looking better. So it's just rewarding.
It
Great.
is.
Well, thank you so much, because your passion clearly shows here. And again, we want to thank you. Quickly again, where can we find your TV show and what time is it on?
Yes, drnancyknows.com, Roku TV, Amazon, keyword Dr. Nancy Knows, all podcast platforms, just keyword Dr. Nancy Knows. It airs every Saturday morning, Mountain Standard Time at 9 a.m.
Perfect. Great. Well, thank you again. Dr. Nancy's integrativemedicine.com. It's a pleasure having you on the show, as always. Have a great day. Thank you. And to all of our listeners, please stay tuned. More of the show is on the way. Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.